Hi, my name is Monica, and I will be presenting bronchopulmonary dysplasia. So there's actually two types of BPD. There's a old and a new. Now, with the old BPD in 1967, it was considered a severe chronic lung injury in premature infants who survived hyaline membrane disease, which is RDS. There were 4 stages, and the higher the stage, the more risk of atelectasis, fibrosis of the lung, cystic areas, or edema occurring. Now with the new BPD, today it's commonly develops in infants born less than 26 weeks, and its findings are described as more uniformly inflated with minimal airway injury or fibrosis. So not as bad as they would make it seem in 1967. Bronchopulmonary dysplasia is a chronic lung disease most commonly seen in premature infants, usually in need of mechanical ventilation or oxygen therapy. The survival rates are between 71 to 81%, which I think is not that bad. In mild cases, as an infant, they may just have a fast respiratory rate, so it might be unnoticeable at first. And then in severe cases, they might be in need of oxygen therapy due to the restrictions in their airway, them not being able to breathe and stuff like that. BPD is the most common form of chronic lung disease in children overall. 10 to 12,000 children in the U.S. are diagnosed with it in a year. I listed a couple causative factors, so prematurity, exposure to high concentrations of O2, inflammation, neonatal infection, pulmonary edema, and poor nutrition as well. Nutrition is super important. I also listed a couple anatomic alterations that occur in the lung when it comes to BPD. There's a lot because obviously there's a lot of stress on the baby's body, and they're not ready for that type of war once they come out the womb. So hyaline membrane formation, atelectasis, excessive bronchial secretions, alveolar hyperinflation, and bronchial mucosal necrosis. Based on a scale of mild, moderate, and severe, according to the infant's age and how well they can breathe on their own, these symptoms and signs must be present in order for you to diagnose an infant or a child with BPD. So they have to be showing tachypnea, an increased heart rate and BP, a decreased lung compliance, wheezing, crackles, also have to have a very low birth weight, and their chest x-ray should show, collapsed lungs, large areas of air, signs of infection or inflammation as well. So these are just, basically like a foundation in order to move forward to be able to diagnose that child with BPD, which is very important. Now, mothers are often given steroids in preterm labor, which most important treatment would be to provide the newborn with exogenous surfactant to prevent the BPD. Studies show that it reduces its incidence from 55 to 26%. It also allows for effective ventilation at lower pressures, which is great because you always want to ventilate at a lower pressure. Now, the goal is to minimize oxygen toxicity and also the need to ventilate. Also to maintain bronchial hygiene, use low inspiratory pressures, and manage MAPS and FRC to assure normal levels. I kind of wanted to also share a story about a little boy named Joseph that was diagnosed with BPD. It was a normal birth for the mother, and a little bit after she gave birth, Joseph's lungs began to fail, and he was immediately intubated, put on a ventilator, and at 100% oxygen. His lung continued to deteriorate over a period of 4 weeks, and then eventually he developed BPD. Every patient is different whenever they're diagnosed with a condition or an illness, and also their treatment's different, the severity is going to be different. Everybody's body is going to obviously react differently. But Joseph ended up being put in a program called CHOP, which is specified for that condition. And they were able to put him on a treatment regimen and, basically care to his needs and be able to basically save his life, which, his parents obviously said that they were very grateful for the program, that they did everything that they could for him, to better his health. Now, after 258 days after being at CHOP, Joseph was discharged. He was obviously at home with nursing and stuff like that, but he's now off of supplemental oxygen and weaning off of the mechanical ventilation. But he continues to receive his PT, his occupational therapy, speech therapy, and stuff like that, which is amazing. And I think that, the CHOP program is really great. And there's also like a lot of programs out there for children that, a lot of people don't know about, or they don't know about the condition until their child goes through something like that. And I think it's a blessing that there is programs like that to go ahead and, be of help to the child. And now Joseph is a healthy big boy. So, yeah. I hope you guys enjoyed the presentation. Leave comments. Thank you. Bye.